Polivinaka, welcome. Thank you for seeing me on such short notice. I'm here to present to you some suggestions of national strategies that could be used to reducing chronic diseases in Fiji. So non-communicable diseases are definitely a global threat, and the threat to the Pacific is even greater, with WHO, the World Health Organization, labeling it a non-communicable disease crisis. WHO has even come up with crisis response packages, which are basically action plans aligned with national NTD strategies, and the things that include like tobacco control, salt reduction, and the implementation of package essential NCD interventions. And these strategies are targeted countrywide at the entire country. According to WHO, a fact sheet on obesity and overweight, obesity levels have tripled in the world since 1975, and obesity is now a major risk factor for diseases like cardiovascular disease, type 2 diabetes, certain cancers, and many other NCDs. Obesity is a double burden of disease that affects low and mid-income countries like Fiji and many of the other South Pacific countries, as we're not only struggling with infectious diseases, but now we have to deal with non-communicable diseases, which really is very taxing on our health systems. So we now introduce the terrible trio of salt, fat, and sugar. And these have been long identified as being the culprits, having irrefutable links with things like obesity and non-communicable diseases. And in fact, the overconsumption of sugar and fats is what leads to a positive energy balance, where you have a lot more calories. And if this particular energy balance, if you're not expending the energy, then this would lead to obesity. And overconsumption of salt is also associated with obesity, and this has been proven in a couple of studies. And it also creates an environment within the body that promotes things like high blood pressure and hypertension. And when you have all these problems, they lead to non-communicable diseases. A combination of the terrible trio with factors like smoking and alcohol consumption and even a sedentary lifestyle really tips the scale in favor of increasing the NCD risk. So let's take the cue from tobacco, and the good news is that here in Fiji, smoking prevalence is slightly lower than what it was before. When looking at the STEP survey, STEP is stepwise approach to surveillance. It's a WHO tool that's been encouraged to be used by countries to track its surveillance. And so we had a STEP survey in 2002 and 2011, and as you can see, there's been a slight decrease in the number of people who did the survey who claimed to have been daily smokers. It was 17.5% in 2002, and it's now 16.6% in 2011. So we think that the success of this tobacco control program has been attributed to a few interventions, such as the increasing tax on tobacco products, which is undergoing another 15% increase in 2019, and also the implementation of graphic packaging on tobacco products, which now shows explicit images of diseases like oral cancer and even lung cancer. And also there's a lot of laws that have been implemented governing how tobacco can be sold and to whom it can be sold. So for example, it's now being sold to people only over the age of 18, and you can't sell them in individual cigarettes. You must sell the entire packet. So it would seem that it would make sense for us to apply what we've learned in the tobacco control to the terrible trio of salt, sugar, and fat. So with the lessons learned from the tobacco control, we look at applying a tax, look at the packaging for the tobacco, and look at laws governing its use. So in Fiji, we have a tax on sugar sweetened and carbonated drinks. It totals a value of 56%, with 32% physical tax, 15% excise duty, and 9% VAT. But the thinking is we could possibly apply this tax a bit more broadly to include some food, looking at food containing more than 25 or 30% sugar, and we should have taxes which apply to these particular foods because they'd obviously be unhealthy. And taxes would have a double benefit by protecting consumers through the higher costs and at the same time earning a revenue for government. In terms of packaging, the laws are very basic and they just specify things like you need to have the weight of the product and ingredients, but nothing like a health star rating that's currently being used in Australia and a few other overseas countries, or even something that mentions calorie quantity. And calorie quantity is especially good for consumers who are trying to really control the amount of calories that they consume. So it's very basic, and there are no real laws governing the limitation of sugar purchase or its consumption, like how it is with tobacco. For salt and palm oil, basically they're exactly the same tax: 32% physical duty, 9% VAT, which totals a 41% tax. That's on salt, and 41% tax on palm oil. But again, the packaging is very basic. There's no specifics, and there's no law governing its use. The thing about tax is it would be very difficult to implement a law to govern the consumption of the terrible trios, but perhaps we could add more to the packaging, similar to what Australia has done with its health food rating system. It still is somewhat controversial at this point, but there are aspects of the health star food rating system that we can learn from, adjust and contextualize basically for our setting. Like for example, there should be more focus on the rating relying on the harmful ingredients, like one of the terrible trio, and if that particular food that's being rated is high in one of or all of the three, then it should receive a lower rating. So this is where the controversy comes in Australia, because they may have be very high in sugar or very high in salt, but because it's high in something healthy like fiber, it receives a higher rating. We don't have to necessarily follow that path. Another important part of the packaging that should become essential is placing the calories on the label. And again, it's important for people who are wanting to address their weight by understanding and controlling the number of calories that they take in. Or we could perhaps adopt the extreme aspect that the tobacco industry has, with the really graphic pictures on its packets, and we might be able to put graphic pictures on sugar confectionery and drinks, and this could be done specifically to deter young children from wanting to consume these products and in essence consuming too much sugar. And this targeting kids is pretty good because it helps target them before they've grown into adults, and as adults they probably they're less malleable to lifestyle change and diet and things like that. And so this is where advertising comes to play a very, very important role. And on the matter of advertising, there's a study published in the Appetite Journal in 2004, which basically demonstrated that the advertisements of unhealthy foods, such as the terrible trios of sugar, salt, and fat, encourage unhealthy choices and could lead to a direct weight gain and therefore obesity, and eventually to non-communicable diseases or chronic diseases. So it's very important. Protecting our children from these kinds of advertisements would be an important piece of the law that could impact chronic diseases in the future. So we end with this picture that I believe summarizes this talk very, very clearly. At the top we have a advertisement by McDonald's that's currently going on, being showed here in Fiji, which says that over the past 50 years McDonald's unchanged goodness has not changed. But when you look down at the picture at the bottom, we have definitely changed over the past 50 years. Our affinity for the terrible trio of salt, sugar, and fat have led us to be more and more unhealthy. And we need to understand that non-communicable diseases, chronic diseases, are here to stay unless we address the terrible trio of salt, fat, and sugar. And they're just as bad as smoking, and it's time we call a spade and treat it exactly how we treat the tobacco industry. We need to implement wider taxes on the trio, come up with more comprehensive packaging, and also laws to govern how we advertise these products, especially to our kids. And let's not let McDonald's lie about its goodness for another 50 years.